Good morning, good afternoon, good evening to everyone. Thank you, Danette, for the introduction. My name is Ben Futransky. I'm the manager of the LCIF New and Emerging Initiatives Department, one of the three programmatic departments within LCIF, reviewing the majority of our grants applications and managing our grant programs. Next slide, please. You can reach the New and Emerging Initiatives at a number of email addresses. New period emerging is the general email address. LCIF District and Club at lionsclubs.org. If you're interested in the District and Club Community Impact Grant Program, specifically the grant process, if there's questions about, does my club or my district have an available balance or how was it calculated, LCIF Donor Services would be the place to go to ask that sort of question. And Leo Grants, LCIF Leo Grants at lionsclubs.org. Next slide. We'll talk first about some general grant program information. Here we see an overview of all of LCIF's grant programs. They are arranged by cause area, with the exception of the District and Club Community Impact Grant Program, which is a unique grant program. We'll get to it later. And it's kind of brought out on its own, but this is a view of them by cause area. And we'll talk about all of these in some detail throughout the session. Next slide. And important to know that each LCIF grant program has different criteria. There's certainly some similarities among programs, but there's also some differences. Some require local matching funds, for example. Others undergo a more technical review. Some can be applied by clubs. The majority is a district level grant application or more multiple district level grant application. They all require some level of Lions involvement or identity with the project. And some grant programs are much more specific to the type of project that could be supported, and some are more general and are open to this broader humanitarian type projects. Next slide, please. And we'll move. New and Emerging Initiatives Department works with 4 major LCIF grant programs: the Childhood Cancer Pilot Grant Program and the Hunger Pilot Grant Program, both of which launched in September of 2019 and are 2-year pilots. The Leo Service Grant Program, which is also a pilot grant program. We'll talk more about that timeline. And the District and Club Community Impact Grant Program. We'll talk first about childhood cancer pilot grants. Next slide, please. Key things to know about childhood cancer grants. The minimum grant amount request is $10,000, while the maximum is $150,000. Local matching funds are required. It's a 50-50 match in developed countries, and 25% local Lions to 75% LCIF in less developed countries. Grants are reviewed and approved by the Board of Trustees at one of their 3 annual meetings in January, May, and August. And like the majority of LCIF grant applications, we ask that they be submitted at least 90 days prior to a scheduled meeting if there's any potential for that application to be reviewed by the trustees at that meeting. Districts and multiple districts are eligible to apply, and only 1 grant per district or multiple district at any time. This last statement can be a little confusing, so I'll clarify that a multiple district and a sub-district of that multiple district both could have a childhood grant at a time. It's not a district or a multiple district, but 1 per district and 1 per multiple district, at least in theory. With childhood cancer, I think the trend will be that Lions are not doing lots of applications or projects in the same area, but rather collaborating together to do just 1 project. Childhood cancer treatment is highly regionalized. Next slide, please. What is the childhood cancer grant trying to support? Really what we call familial support and improving the quality of life for children receiving cancer treatment and their families. specifically capital investments in infrastructure and equipment that can help do this. Some examples, and these aren't an exclusive list, but would be construction, expansion, or renovation of waiting rooms, family homes where children and their families can stay while they're receiving treatment far from home. You know, a good example of that I think the most of us know is the Ronald McDonald houses, but there's lots of these around the world, and that's certainly an area that I think Lions can support with this grant program. Projects that improve transportation to and from medical appointments, projects supporting educational and recreational opportunities for patients during their treatment. What it doesn't support is medical equipment or medical infrastructure. That's really important. That's kind of very technical. We think that the area where Lions can make the strongest contribution with LCIF support is, again, this area of familial support. We're also not funding scientific research or individual treatment costs. A good example of a recently approved grant was cancer clinic in northern Wisconsin that serves both adults and children. The facilities for children were not the greatest, and with LCIF support, the project plan is to upgrade the waiting room, make it much more kid-friendly, have a mural, a place for kids to play, things like that, so that when kids are spending, many hours over oftentimes many years in a single location getting their treatment, that they can really be comfortable while they're doing that. Next slide, please. Hunger grants, another grant program looking at supporting capital investments. The minimum grant amount is $10,000. The maximum grant amount is $100,000. Somewhat uniquely, it's a 25% local match requirement for all countries, developed and less developed countries. LCIF can match up to 75%. Grants are also reviewed by the Board of Trustees at one of their 3 annual meetings, and only districts are eligible to apply, 1 grant per district at any given time. Next slide, please. So again, they're for capital investments and select operational expenses during a startup period for projects that are focused on alleviating hunger. A classic example would be the construction or expansion of a food bank, food pantry, feeding center, or something similar. Constructing or expanding kitchen facilities or dining facilities as part of a school-based feeding program. I think there's a tremendous opportunity for Lions around the world to support school-based feeding. There's a lot more schools than there are food banks, and they can oftentimes use Lions and LCIF support to upgrade those facilities and get good, healthy food in a sanitary fashion to kids in these schools. Purchasing kitchen equipment, stoves, ovens, refrigerators, and the like for all sorts of facilities, providing feeding, furniture, chairs, tables, etc. for feeding centers, and vehicles to transport, collect, and deliver food. A good example of a recently approved project is that there was a community-based organization operating a meal delivery service for seniors. They wanted to expand to provide some in-site dining as well. They're working with Lions to do that, and LCIF is supporting the expansion of a dining room facility as well as their kitchen so they can cook more food. So they'll continue to deliver food, but also provide in-person meals as well. Grants don't fund purchase of land and things like that. Purchase of food would be the common question that we often receive, and the grant is not designed to purchase food. Next slide. LEO Service Grants is a program designed to support LEOs in working with Lions to do hands-on service projects. The Board of Trustees actually concluded their meeting this morning and approved some changes to this grant program. These changes will go into effect in July. High-level summary of that would be the change in July it'll be $5,000 maximum request for districts or multiple districts, and some other relatively minor changes to the criteria, and it will be operated for a 2-year pilot period. However, until then, LEOs can continue to apply for LEO service grants using the existing grant application, providing $2,500 for districts, multiple districts, $5,000. Again, this is supporting strong hands-on service led by LEOs. Next slide, please. Next slide, Dana. District and club community impact grants. We'll talk a little bit about eligibility for the grant program. And that is, of course, that clubs or districts that meet a minimum donation amount are eligible to receive 15% of their donations back in DCG funds. And the way they access those is by applying for a district and club community impact grant. This calculation is made based on the fiscal year, unrestricted donations only. Next slide. Club eligibility, as I'm sure most everyone on this webinar knows, is minimum of $5,000 unrestricted in a single fiscal year. And of course, if clubs do qualify at any time, if they don't want to use that balance by applying for a DCG grant, they can transfer it to their district. Next slide. District eligibility, that's $10,000 cumulatively over the course of a single fiscal year. These are donations by the district as well as unrestricted donations by clubs in the district that do not otherwise qualify. DCG grants, and what do they fund? Specific humanitarian projects. This is probably our most wide open grant program in terms of what can be supported. If your club or district is doing it and it's making a positive impact in the community, it is probably eligible. But some things aren't, right? Here's a few examples: membership dues, paying for dinner after a club meeting, reimbursement for projects that have already taken place. So there are some limits, but it's pretty wide open in terms of what can be supported through DCG grants. If there's any questions, always reach out to us in the New and Emerging Initiatives Department. We'd be happy to answer your question. Next slide, please. District and club community impact grant funds can be used as the local matching fund requirement for another LCIF grant program. I personally think this is a wonderful use. So you're applying for a diabetes grant. There is a local matching fund requirement. The district says, hey, we have an available balance of $7,000, for example. We'd like to apply that toward the local matching funds requirement of our diabetes grant application. So that can be done. We have some information on our website explaining the process. And again, if there's questions, always feel free to reach out to New and Emerging Initiatives Department or anyone within the LCIF grant programs, and we can answer your questions. Next slide.
Thanks, Ben. Now we'll pause to take some questions from the attendees. Christy and Latanya, do you have any questions for us?
Hello, I have one question, and somebody asked, can more than one grant be open at a time if they are from different programs?
Grants open in process at any given, at the same time, and they want to apply for a childhood cancer pilot grant, they can definitely do that. They could also apply for a hunger grant. They could also apply for a diabetes grant. It's more grant program specific. I will say, though, that from a practical perspective, since the majority of these do require local matching funds, we're probably not going to see a district with that many open at any single time, but there's certainly nothing stopping a district or multiple districts from doing so.
Thanks, Ben. Christy, did you have any additional questions in there as well?
Yep. If a donation is made towards the disaster relief fund, can it be applied towards a community grant, towards a DCG?
Since a donation for disaster relief is considered a designated donation, that would be excluded from that calculation.
Okay, and what is the match for hunger grants?
The hunger grant is 25% local Lions minimum, and LCIF can match up to 75%. So Lions in North America are certainly getting a favorable match compared to, say, our matching grant program, which is 50-50 match.
Okay, and then another question is for DCG grants. It says the slide states that deceased members' funds are counted. If this is correct, would an estate gift of the member not be counted or counted?
That's an excellent question. My expertise with the actual is somewhat limited. I suspect the answer would be no, because I believe estate gifts are treated a little differently by the foundation than individual gifts. I think that this example is speaking specifically about, someone donates to LCIF, they, unfortunately pass away, but once the donation is on record, it's on record and would be counted. I can't speak specifically about how estate gifts are considered.
Okay, and then can you clarify again what is an unrestricted donation that is eligible for a DCG grant?
So an unrestricted, and Christy, maybe you can answer this better than I can. Obviously, it's not restricted for a select purpose, right? So it's not donated for disaster. So I think any donations for empowering service through the campaign are considered unrestricted. If that's
You answered that very well, Ben. I would have said the same.
Yeah.
And there's a few questions coming. There's a few more questions coming in. I just wanted to say if there's any questions that do not get answered tonight, then to just make sure that you email it to us, and then we'll make sure that gets answered, and it will also be available on an FAQ worksheet later at a later time. I think that's it for now, and then if I have any other, then I'll apply it to the next.
Great.
Thanks, Christy. Thanks, Ben.
Thank you.
Okay, next we have Cassandra Rotolo. Cassandra, Cassie, are you there?
What is the one? Hello, everyone. My name is Cassandra Rotolo. I am the Regional Program Specialist in the Humanitarian Initiatives Department for Constitutional Areas 1 and 2. Next slide. On your screen now, you are seeing some of the proxy emails for the department. Any questions regarding humanitarian grants can be addressed to these emails and will be responded to. Next. Some of the grants managed by my department include matching grants, formerly known as standard grants, anything that is board designated, all of our emergency grants, which include major catastrophe, community recovery, disaster preparedness, as well as the Alliance Quest implementation grants. Next. Humanitarian grants are matching grants, are some of our most common grants. Some of you have probably been involved with them either as matching grants or previously as standard grants. These are used to address important humanitarian needs within your communities, generally expanding or improving services for vulnerable populations that address some emerging global needs. And of course, those needs vary from area to area and even district to district. Some important things to know about matching grant applications. You have to have a minimum of 2 Lions clubs involved in financially supporting a project. Single club projects are not eligible for these grants. Your applications must include either quotes or pro forma invoices to substantiate your budget. The district cabinet for a district level grant or the multiple district council for an MD level grant has to approve these applications, and minutes from those meetings must be included when you send them to us. Projects cannot already be underway. You can certainly be fundraising toward a project, but anything that has already begun, you've broken ground, you've leased equipment, anything like that is not eligible for grant funds. Next slide. Lion's Quest is our social emotional learning program. This includes things like substance abuse prevention, decision-making, citizenship, things like that. This is implemented primarily in grade and high schools and does require a 3-to-1 match. Next slide. We also administer all of the disaster grants. This includes 4 categories. Emergency grants provide up to $10,000 for districts immediately after a natural disaster. If a district finds that these immediate needs, including food, water, clothing, medicine, are being adequately addressed by other agencies, the Red Cross, FEMA, Salvation Army, you do have the option to wait up to 60 days after a disaster to apply for a community recovery grant, which addresses some of these kind of post-disaster needs after FEMA's left town, after the Red Cross has moved on to the next disaster. There are things left behind. There is debris that needs to be removed. If the Lions want to go that route, that's a $20,000 maximum. You can do emergency or community recovery, but you cannot get both grants for the same emergency. You also have the option of a disaster preparedness grant. This provides up to $10,000. There is a 10% matching requirement for this to help a district prepare for future disasters. So if you are in an area prone to flooding or prone to tornadoes or things like that, you might consider a disaster preparedness grant to help kind of shore up the resources that you'll need to address these things as they come later. And then the major catastrophe grants are for disasters really that make international news. These impact typically thousands of people, and the rebuilding here often takes years. Districts cannot apply for these grants. They are awarded by the chairperson and the international president. Think of disasters like Hurricane Katrina or Hurricane Harvey more recently. These are the types of disasters that qualify for major catastrophe grants. Next slide, please. You may have seen that LCIF is addressing the COVID-19 pandemic through a modified version of our emergency grants. These, again, are up to $10,000 available for districts to essentially shore up the resources of our frontline workers. So we're providing a lot of PPE, essentially, and food to hospital staff, nursing home staff, firemen, paramedics, EMTs. These grants are unfortunately not providing general food assistance or food banking for the general public. We are not providing masks or other PPE to the general public, but to date we have awarded 232 grants totaling more than $3.8 million. If this is something that your district or your multiple district is considering getting involved in, I would certainly encourage you to reach out to us as soon as possible. Again, this is a modified version of the emergency grant, so you'll need to take those steps quickly. And please know that every request is considered on a case-by-case basis. Next slide. We've updated this a little bit since yesterday, but again, 232 grants for more than $3.8 million so far. Next slide, please. There are other grants administered by the Humanitarian Initiatives Department. Designated grants are grants funded by designated donations, essentially. The board has the privilege of directing certain grants, including seed grants. None of these are grants that Lions can apply for, but you should be aware that they exist, and they generally fall within our key areas and in areas that Lions have determined are of importance to them. Next slide. At this point, we'll take questions.
Latanya, Christy?
Okay, we have a few questions. Some of these, most of them, they might be for Ben. One of the questions was, can a disaster donation be repurposed as an empowering service donation?
That's a good question. I'd almost defer to you, Christy. I believe it's possible if it's if that request is made in a certain time period.
Okay, I would say to call donor services, and the donor would need to discuss that with the donor services department. Danette, do you have anything to add to that?
No, that was actually what I was going to recommend.
Okay. Sorry, go ahead.
Christy. I would just add that that request would need to come from the donor. LCIF would not simply reallocate a donation without donor advisement.
Thank you, Cassie. Next question, can you roll over any amount for a DCG, or is there a minimum?
Any amount can be rolled over for up to 15 years, which is to say actually 15 years from when it was earned. So a club that qualified in the first year of the program several years ago has 15 years to use, whatever, we'll just say it qualified with $1,000 available balance. 15 years to use that $1,000. If it doesn't use it in that time, it would, roll off and disappear. And then, subsequent years, the same thing. So there's certainly the opportunity if a club or district wants to, donate generously to LCIF over a number of years, build that available DCG balance, and then, do a larger application, financial request-wise, they can definitely do that.
Okay, for the COVID-19 relief grants, who has to be in charge of that? Who's the grant administrator? Is it a district governor, or could it be anybody?
So the COVID-19 emergency grants are awarded either at the district or the multiple district level. If it is the district that applies and the district that receives the grant administrator is the current DG. If the grant is awarded to the multiple, that would be the current council chair.
Okay. We have another question saying that there's local emergency offices that could use the support from a COVID-19 grant, but they cannot get the PPE or sanitizer because of shortages, and they may not be able to actually get those supplies to the clinic before the end of June. Is there a way to get the grant showing the order even if the delivery date is delayed until after June 30th?
The COVID grants have to be implemented, completed, and reported on within 60 days. So the end of June would technically fall within that. That would be fine. But you would need those items delivered before you can submit the final report. So you're getting close there, but technically it would be okay.
Okay, and then someone else asked, there used to be a grant category for handicap accessible homes that are built in partnership with Habitat for Humanity. Does this still exist? And if so, where?
We are no longer issuing Habitat for Humanity grants. The foundation does not provide individual assistance, which is really kind of where that falls. Your best bet is probably a DCG grant for help with that.
Okay, and then this is to Hunger Grants, what is the maximum for Hunger Grants, and then what is the match?
So the maximum request amount for hunger grants is $100,000. The minimum request amount is $10,000. And that's actually the same as the matching grant program. What makes hunger grants unique is that it's a 25% local Lions match minimum for Lions around the world. There's no difference between a developed country or less developed country. Everyone 25% local match.
Okay, and then lastly, who provides the 3 and 3-to-1 matching grants?
That was for the Lions Quest. It's a
Okay.
3-to-1 match for Lions Quest implementation and expansion grants.
Okay, thank you. I think that's all we have over here.
Great. Thanks, Christy. Thank you, Ben and Cassie. We'll go ahead and move on. Next up, we have Jillian Gibbs, Department Manager for our Global Health Initiatives. Jillian? Hey, Jillian, are you there?
Yes, I just had to wait to be unmuted. Thank you, Danette, and thank you for organizing this event and inviting me to be part of this exciting opportunity to share information on all of the grant programs that LCIF has to offer to Lions. Next slide, please. Here is the contact information for Global Health Initiatives. We manage the Site First and Diabetes grant programs. We monitor these inboxes daily, so please feel free to reach out at any time. We are happy to answer any question, concern, inquiry. Please don't hesitate to contact us. Next slide. So as I mentioned, the Global Health Initiatives Department manages both the Site First and Diabetes grant programs, and I will go through the different details of both of those programs. Next slide, please. First is the Site First grant program, which I'm sure you're all very familiar with. The mission of the Site First program is to build comprehensive eye care systems to fight blindness and vision loss in underserved communities, so that high quality, cost-effective, equitable, and sustainable services can be provided to those most in need. Most Site First projects focus on the major causes of blindness or vision impairment for that community, which can include diseases such as cataract, trachoma, or diabetic retinopathy, to name a few. There's no specific grant limit per project. However, there is an annual limit of $10 million total for all Site First grants approved per year. There are also no specific matching funds required, with the exception of some high-cost equipment items, which are detailed in what we call the EQ Plus policy, which is available on our website. And the Site First Advisory Committee meets twice a year to review grants in August and January. Next slide. Lions develop and manage Site First projects in partnership with local health authorities and eye care professionals. These grants are approved to upgrade existing eye hospitals and clinics in underserved communities in order to expand access to service. Site First also supports human resource training, as well as community outreach, eye health, education, and services. Site First does not fund the construction of new eye care centers, any operational expenses, or patient subsidies. Next slide, please. The Site First program has a high level of technical oversight. Global Health Initiative staff register and review the applications. There are also technical advisors for the program that serve as consultants to Lions on the development of projects, and they also consult with LCIF staff on the review of applications and the monitoring and evaluation of approved projects. In addition, the Secretariat of the Site First Advisory Committee is an ophthalmologist from the World Health Organization, who reviews all applications prior to presentation to the committee. And the committee is comprised of both global eye care experts and Lions leaders. Next, please. Moving on to diabetes. As you all know, Lions are focusing on addressing diabetes and responding to the growing epidemic. And LCIF is supporting this work through the funding of comprehensive health initiatives. The mission of the Diabetes Grant Program is to reduce the prevalence of diabetes and improve the quality of life for those diagnosed. Grants are available for up to $150,000 for districts and up to $250,000 for multiple districts. Lions must provide 25% of the project budget in matching funds, and there's a minimum of 2 clubs that must be involved in the project and financially contribute to the matching funds. Grants are reviewed at each of the 3 board of trustees meetings, and there can only be 2 open diabetes grants per district and 1 per multiple district at any given time. Next, please. The Diabetes Grant Program also has technical oversight. Along with LCIF staff, technical advisors review the applications and provide guidance and feedback to Lions and staff, and they attend the program's committee meetings where the applications are reviewed by the trustees. Next. The Diabetes Grant Program supports large-scale diabetes prevention, management, awareness, and service activities that fall within one of the 4 intervention areas shown here, which include youth camps or retreats, human resource training, infrastructure development, and screening initiatives when combined with comprehensive follow-up care plans. Lions are encouraged to work with local medical experts, diabetes associations, and public health agencies in the development and implementation of projects. And most projects actually address more than one of the intervention areas. And I will go into each of the program areas in more detail. Next, please. So first we have youth camps, retreats, and symposiums. These types of projects should enhance or expand the quality and reach of overnight day camps, day camps, retreats, or symposiums that promote diabetes self-management and education. Diabetes grants will fund renovations to existing recreational camps for children living with diabetes, as well as some modest operating expenses to expand programming at the camp. In addition, diabetes-focused retreats or symposiums for medical professionals are eligible for funding. The grant program does not fund individual scholarships, participant travel to camp, or any new construction or major operating expenses of camps. Next, please. The next intervention area is human resource training and capacity building. These projects should increase the competency of health personnel and Lions in order to provide diabetes prevention and management care. These grants fund tuition for credentialed programs, professional development activities, as well as any travel or lodging expenses associated with the training. The diabetes grants under this intervention area do not fund salaries, training in foreign countries when there is in-country training available, or any non-diabetes specific training. Next, please. Infrastructure development and equipment. Infrastructure projects should focus on improving the quality and quantity of diabetes services that are provided to underserved populations. These grants fund renovations to existing diabetes clinics. It can fund the purchase of medical equipment that's specific to diabetes, as well as equipment used for screening for complications of diabetes. We do not fund new or start-up diabetes centers, any operating expenses of a diabetes clinic, or any equipment for research, dialysis, advanced cardiac care, or treatment of diabetic eye disease. Next, please. Community screening projects have been very popular, and those are funded when they are providing access to diabetes screening and awareness for underserved communities. Diabetes risk assessments must be used and referral networks must be in place for follow-up care for those identified as at risk for diabetes or complications. These diabetes grants will fund the logistical fees required to set up a community outreach screening event, as well as any per diems for diabetes or medical professionals, and any required screening equipment or materials. The grants will not fund any patient costs, any insulin or other medication, will not fund continuous glucose monitors or any equipment not related to screening. And next, with that, I think I'm passing it back to Ben.
Thank you, Jillian. I'm going to talk briefly about Lions Quest grants. Certainly any questions about Lions Quest can be directed to the Lions Quest department at lionsquest@lionsclubs.org. Next slide, please. There are 3 grant programs managed by the Lions Quest department. Program grants, promotional grants, and community partnership grants. And we're going to talk a little bit about each of those. Next slide, please. Promotional grants are up to $1,500 and support one or more promotional seminars for Lions educators and community members interested in starting a Lions Quest program. One example of that is funds can be used to rent a venue for a seminar, print promotional material such as brochures, and rent audiovisual equipment. Community partnership grants are available in amounts up to $15,000 and are awarded to bring Lions Quest to a new community or to reactivate a dormant Lions Quest program. These can be used to hold multiple program educational seminars for clubs, as well as education and government administrators. Both of these first 2 grants we're discussing today are one-time non-matching grants, meaning they don't require local matching funds. The third program, the Lions Quest grants, as Cassandra mentioned earlier, are actually managed by the LCIF Humanitarian Initiatives Department, and they're available in amounts up to $50,000 for a single district and $150,000 to a multiple district to help implement or expand the Lions Quest program within the district or multiple district. As also mentioned earlier, unlike the other 2 Lions Quest grant options, this grant is a matching grant requiring a 1-to-3 match from local Lions or other local funding sources. All Lions Quest grants are awarded at the district or multiple district level, so no club level Lions Quest grants. The application process is for the Humanitarian Initiative Lions Quest grant is a board decision grant by the Lions Quest Advisory Committee, and they meet twice a year in January and August. The other 2 grants, promotional grants and community partnership grants, are accepted and reviewed on a rolling basis by LCIF staff. I'd strongly suggest, since the Lions Quest program is unique and circumstances in the community might be quite specific, that anyone interested in one of these 3 grants reach out to the Lions Quest department and discuss the situation, and they can best advise on how to develop a successful grant application. Next slide, please. And here's just a little explanation of the process for the Humanitarian Initiative Lions Quest grants. Submitting the application, reviewing by staff working with Lions on revisions, grant summaries finalized, and then finally a decision by the Lions Quest Advisory Committee. I'd add that general process, those first 4 steps, are pretty similar across the majority of LCIF's grant programs. And with that in mind, I'll take the opportunity to give a little advertisement for a future publication, which hopefully will be out in just a couple months, 10 tips to apply for an LCIF grant, where we try and give advice to Lions in an easily digestible format on how best to apply for an LCIF grant. That document is in the process of being laid out and translated, and I think the idea is that it will be made available to Lions in the month of July. So look forward to that in the near future, and we hope that's a very useful resource for Lions in helping them develop LCIF grant applications. Danette, back to you, and thank you very much.